Infectious enteritis in dogs and cats. So the recap on small intestinal disorders: in acute, it can be infectious, and chronic is usually a response to food and drugs or neoplasia. Acute hemorrhagic diarrhea syndrome, AHDS. So discuss viral enteritis, feline viral enteropathies, bacterial enteritis, and protozoa. For viral enteritis, talk about canine parvoviral enteritis, feline panleukopenia, and canine coronaviral enteritis. For feline viral enteropathies, talk about feline coronavirus, FCOV, and feline immunodeficiency virus, FIV. Bacterial enteritis can be caused by Campylobacter, Salmonella, Clostridium, and pathogenic E. coli. If it's mild, do not give antibiotics. If it's severe, in the case of Campylobacter, give azithromycin. And the protozoa and parasites that can affect dogs are Isospora, Giardiasis, roundworms such as Toxocara, which causes potbelly in pups. So infectious enteritis in dogs and cats. So for acute intestinal disorders, they're usually diet-related, drugs or toxins, or acute hemorrhagic diarrhea syndrome, and they're usually infectious by viruses, bacteria, or parasitic. Chronic diseases are usually food responsive, antibiotic responsive, or immune suppressive responsive, or by neoplasias of the small intestines, or alimentary tract parasites. So acute hemorrhagic diarrhea syndrome. So it's a toxogenic Clostridium perfringens that causes it. It most commonly happens in young, middle-aged, small breed dogs, especially in winter. It's usually acute and it's severe. It starts with vomiting, which leads to hemorrhagic diarrhea, and with so much fluid loss, it can cause hypovolemia. Hematocrit usually increases and there's a neutrophilic left shift. With aggressive fluid therapy, there's usually a good prognosis. Parenteral antibiotics are rarely necessary, only if there's no response to fluid therapy or if there's a risk of septicemia. And infectious diarrhea can be viral or bacterial. For viral enteritis, we start with canine parvoviral enteritis. The virus is canine parvovirus 2. It's very prone to antigenetic variants, such as canine parvovirus 2A, B, and C. Canine parvovirus 2A also affects cats. The disease is very frequent despite vaccination protocols. The mothers have maternal immunity, which is passive, and it can last for 3 to 4 months. So only vaccinate puppies at 16 weeks old or later, as they still have maternal antibodies until that point. These viruses are highly contagious and they enter the body through the fecal or oral route. So for the pathophysiology, the viruses have an affinity to rapidly dividing cells, such as the intestinal crypts on the base of the villi. This can lead to crypt cell necrosis and bloody diarrhea. Bacteria can have bacterial translocation. It's when the bacteria go through the damaged wall. And bacterial translocation and immunosuppression causes sepsis. For the clinical findings, there's usually a 5 to 10 day incubation period, and it happens in animals around 6 weeks to 6 months mostly. It's found in kennels and shelters and happens when there's a lack of vaccination. The severity depends on the age, breed, and the immune system and vaccination history, and stress from a shelter, and the virulence of the strain. Breeds that are affected are Staffordshire Terriers and Labradors, mostly. In the clinical findings, we can see severe diarrhea. It's profuse and bloody, along with vomiting, anorexia, fever and lethargy, and dehydration. In the lab tests, we expect to see leukopenia, and we also expect to see anemia and decreased potassium, and decreased total protein. For a definite diagnosis, use fecal ELISA or a PCR. The virus shedding window is short. The virus sheds for 5 to 7 days after symptoms. And in this case, the test can be negative. Make sure to treat with fluid therapy, antimicrobial therapy, and feeding. For the fluid therapy, make sure it's aggressive and give crystalloids, colloids, and electrolytes and glucose. For antimicrobial therapy, you can give a broad spectrum such as amoxiclav and gentamicin. And for feeding, syringe feed the animal and give it intestinal diet, so highly digestible food. For feline panleukopenia, this is the feline parvovirus. It's highly contagious and has a high mortality, but it's more rare than parvovirus in dogs. There's even less time to detect this virus as the virus sheds for 1 to 2 days. You can expect to see anorexia, fever, depression, dehydration, vomiting, and hemorrhagic diarrhea. In canine coronaviral enteritis, the coronavirus invades the villus tips, and there's only mild destruction compared to parvovirus. It's usually found in kennels or shelters, the clinical signs can be acute or mild. You can have watery mucoid diarrhea, there's no fever or no leukopenia, and it can also be asymptomatic. There's also a pantropic coronavirus, and this is a mutation. It's a severe form. It leads to severe neurological signs, such as ataxia, and patients die within 1 to 2 days. And for feline viral enteropathies, we can have feline coronavirus. This is usually subclinical and mild. It can lead to acute watery diarrhea. Feline immunodeficiency virus, such as FIV. This can cause secondary infections, which leads to enteritis. And feline leukemia virus. This is fatal and leads to a peracute enterocolitis and chronic diarrhea. For bacterial enteritis, we have Campylobacter, Salmonella, Clostridium, and pathogenic E. coli. They all have pathogenic and non-pathogenic strains. The predisposed animals are young, in stressful conditions, or that are immunocompromised or fed raw meat diets. Asymptomatic animals are more common than the ill animals. Diarrhea is usually absent or can be soft and watery or mucoid. If it's bloody, it's usually acute. In the diagnosis, it's difficult to distinguish between a pathogenic and non-pathogenic strain. For Campylobacter and Clostridium, it's better to do a PCR. For the treatment, if it's mild, do not treat with antibiotics, as this can lead to resistance and prolonged shedding. If it's severe, you need to isolate and treat. So isolation is very important, especially for the owner. And antibiotics are selected after culture. If it's Campylobacter, so where there's mucoid, bloody diarrhea, or fever, you give azithromycin. If there's Salmonella, which can lead to bloody or septicemia, you give enrofloxacin. For the protozoal infections, you have Isospora. It's found in young animals less than 1 month old, in new kennels, or with a new owner. They usually have acute diarrhea. It can be mild, and it's found in puppies or kittens less than 1 month old. The second disease is Giardiasis. It's widespread and it's found everywhere in the world. It's usually asymptomatic, but it can be mild or acute. It's rarely severe, maybe in young animals. And the diarrhea is like a cow pad, and it's not watery, it's very fetid. And do the fetal flotation with zinc sulfate. For roundworms, we can have ascarids, such as Toxicara. These happen in young animals where there's diarrhea and there's a failure to thrive, and they have a pot belly, which can lead to intestinal obstruction. In hookworms, such as Ankylostoma, it affects young animals in unhygienic conditions. There's usually diarrhea, it's normally bloody, and anemia. In tapeworms, we can see Dipilitium canum. It's usually the intermediate host are fleas and lice, and the clinical signs are rarely, but it can affect human health.